बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलामुअलैकुम। डॉक्टर मोहम्मद शाहिद के यूट्यूब चैनल पर खुशामदीद। आज हमारी खुशकिस्मती है कि हम आज बात कर रहे हैं डॉक्टर ज़ियाउर रहमान से वैस्कुलर सर्जरी के बारे में। वैस्कुलर सर्जरी में FCPS किस तरह किया जा सकता है और इसका क्या स्कोप है, डॉक्टर ज़ियाउर रहमान हमें तफसील से बताएंगे। डॉक्टर ज़ियाउर रहमान से मेरी बहुत पुरानी दोस्ती है और आप ग्रेजुएट हैं अल्लामा इकबाल मेडिकल कॉलेज लाहौर के। उसके बाद आपने FCPS पार्ट 1 जनरल सर्जरी में करने के बाद अपनी ट्रेनिंग आगा खान यूनिवर्सिटी हॉस्पिटल कराची से की और उसके बाद FCPS पार्ट 2 करने के बाद पाकिस्तान में अपनी वैस्कुलर सर्जरी की ट्रेनिंग आगा खान यूनिवर्सिटी हॉस्पिटल से की। उसके बाद आप आगा खान यूनिवर्सिटी हॉस्पिटल से मुंसलिक हो गए एज अ सीनियर इंस्ट्रक्टर, असिस्टेंट प्रोफेसर और आजकल एसोसिएट प्रोफेसर ऑफ वैस्कुलर सर्जरी के तौर पर काम कर रहे हैं। आपने मास्टर्स किया है वैस्कुलर सर्जरी में UK से और इसके अलावा फ़ेलोशिप भी की है इंटरनेशनल फ़ेलोशिप UK से। आपका वसी तजर्बा है वैस्कुलर सर्जरी में, पाकिस्तान में एक बड़ा नाम है। तो हम आज बात करते हैं डॉक्टर ज़ियाउर रहमान से। ओवर टू डॉक्टर ज़ियाउर रहमान।
This is very important question कि what is vascular surgery? Even आम लोगों को छोड़ें, even medical community do not know what a vascular surgeon do. So vascular surgery surgeon actually deals with the blood diseases of the blood vessels, arteries or veins and lymphatics को deal करता है। Any arteries and veins, दो main problems होते हैं arteries को, या तो blood supply कम हो जाती है जिससे ischemia होता है, either acute or chronic ischemia, या एन्यूरिज्म हो जाता है विच हैज़ रिस्क ऑफ रप्चर और थ्रोम्बोएम्बोलिज्म। तो इनको डील करते हैं।
ये तो बहुत कॉम्प्लेक्स फील्ड है। तो आप अपनी लाइफ बैलेंस को किस तरह जो है वो मेंटेन करते हैं?
दैट इज़ वेरी इम्पॉर्टेंट क्वेश्चन। एक्चुअली अगर आप वेस्कुलर सर्जरी को थोड़ा सा आगे जाएंगे तो वेस्कुलर सर्जरी में आगे फील्ड्स हैं। देयर इज़ अ फील्ड ऑफ वेस्कुलर ट्रामा, कैरोटिड डिजीज़ है विच इज़ सेटिस्फाइंग। there is aneurysmal disease, aneurysm को डील करने की disease है। then there is a venous component है। so and then there is academic vascular surgery, then there is a research part of that। so you have to make your work life balance, but it gives you results when you see your patients limbs have been saved, their life has been saved, they have been prevented from strokes। that give you a lot of satisfaction।
So Dr. Zia, why vascular surgery? क्यों इस फील्ड में आना चाहिए after FCPS surgery?
I will say इसको हम दो एस्पेक्ट से देखते हैं। एक तो देखते हैं कि पेशेंट्स के एस्पेक्ट से देखते हैं, सेकेंडली हम फ्रॉम द एस्पेक्ट ऑफ द सर्जन देखते हैं। पेशेंट एस्पेक्ट, फॉर एग्जांपल द कंट्री नीड्स दैट there are a lot of venous disease and venous patients are neglected। There are a lot of patients who present to us late with gangrene and tissue loss and at the risk of amputation। उनकी amputation बच सकती है if they are a properly trained vascular surgeon। and there is a lot of peripheral vascular trauma in Pakistan which needs to be treated by properly trained hands। then there is epidemic of chronic renal failure in Pakistan, and we need a lot of vascular surgeons who can actually help in maintaining the dialysis access and maintain them over time। so country needs a lot of vascular surgeon, and if I see from the aspect of this vascular surgeon that whether this field is rewarding or not, I will say the answer is yes। One is that this field, most of the tertiary hospital in the countries do not have vascular surgeons, and there is always chances one to settle there। then even the opportunities for the vascular surgeon all over world is open। there is lot of demand of vascular surgeon in Middle East, even in UK and USA। so if one wants to pursue his career in Pakistan or outside Pakistan, this is very rewarding field।
डॉक्टर ज़िया, मैंने तो आपको ट्रेन होते देखा है एज अ फेलो। सो आप इतने एनर्जेटिक थे उस वक्त भी, अभी भी, तो क्या ये खुसूसियत होनी चाहिए वैस्कुलर सर्जन में?
नहीं, thank you for your kind compliment, thank you for that। I see this. This is not a first fellowship. This is a second fellowship, and when one is actually selecting this fellowship, one has to be very selective. And usually they have reached at a very maturity phase पे आ चुके हैं, because this needs a lot of hard work, lot of dedication and commitment to this field. This field you will get the training is really tough one. You will be one person is on call every third day. Then they have to go through a very strong academic rota, and then there is also demand to learn new skills and new techniques within these 2 years. And then I will always say that one's training does not stop at the end of residency or fellowship. It continues whole its life, so that training and learning process continue with every day. So if one has to excel in any field, one has to actually be in a learning phase. तो मैं भी आपको भी बहुत उसी तरह एनर्जेटिक और यंग पाता हूँ जितना मैं 2010 में आपसे मिला था।
डॉक्टर साहब मुझे ये बताएं कि पाकिस्तान में कौन-कौन से सेंटर्स हैं जहाँ ये ट्रेनिंग हो सकती है वैस्कुलर सर्जरी की?
I will say this is very right time पे आपने ये क्वेश्चन किया, and this is a golden opportunity for the people, because if we see our 10 years back, there were even 1 or 2 centers in Pakistan, and there were very few opportunities to train vascular surgeon locally. Now we have, mashallah, 8 centers within the Pakistan which are well recognized. There are 2 centers in Karachi. One is Aga Khan University Hospital, and one is in Civil Hospital. And then there are 2 centers in Lahore. One is CMH Lahore, and other is the Doctors Hospital, which has recently been recognized. Then we have one in Shifa International Hospital in Islamabad, and one in CMH Rawalpindi, and same is true for CMH Peshawar, which is also recognized. So there is ample opportunities for trainings for the persons who definitely wanted to select vascular surgery as their career.
आपके ख्याल से ये 2 साल की ट्रेनिंग क्या इम्पैक्ट डाल सकती है आपके फ्यूचर गोल्स के लिए?
I make sure, I think that if one selects after 4 years of general surgery and add 2 years of vascular surgery, and then they come into the market, they have a huge edge over the persons who have only the general surgery, because it gives them a distinction. Number 2, it gives them a new skills, and number 3, it gives them a huge variety of the patients which are untreated, and they can easily make their place within the market and excel in it.
FCPS जनरल सर्जरी करने के बाद जब फेलोशिप के लिए आप अप्लाई करते हैं डॉक्टर ज़िया, तो क्या इंटरव्यू के अंदर आपको ख्याल करना है कि इस फील्ड के बारे में क्या सवाल किया जाता है?
Unfortunately, vascular surgery is not being taught at undergraduate and the postgraduate level. So जब आप इंटरव्यू के लिए आएँ, तो any person who comes for interview for vascular surgery, it is good to read about the basics of that. Then we also know about the limitation of that, but we want a person who is actually personality wise quite sound and has a clear vision and goals, have a good communication skills, it quite good at problem solving, do know the basics ethical issues in patient care, and the most important thing is willing to learn and enthusiastic and energetic. These are the 4 or 5 qualities which we see in a person, and the attitude to help the patients and take patient care as the priority number 1. This is the attitude we want. If one presents with this type of oneself in an interview, there is high chances the person is going to be selected for the training.
FCPS vascular surgery की ट्रेनिंग की रोटेशंस क्या-क्या होती हैं?
Vascular surgery training is 2 years, जिसमें core training एक component है, and then there are 2 major components. One is interventional radiology and one is the cardiothoracic surgery. Interventional radiology is of 2 months एंड जिसमें बेसिकली फोकस जो होता है, एम ऑफ रोटेशन इज़ के बेसिक्स ऑफ imaging technique like ultrasound, CTA, MRA they will learn, and also basics and the skill, basic and advanced of the endovascular skills. Then in cardiothoracic surgery, candidate is rotated for 2 months, and the aim there is to know how to expose the vessels in the chest and to learn from doing different type of anastomosis from a different specialty. Yeah.
इसका स्कोप पाकिस्तान में और अब्रॉड वो बता दे थोड़ा.
As I have told कि this is wide open field because venous disease is quite common in Pakistan. Diabetic patients में जो peripheral vascular disease is epidemic. Chronic renal failure is epidemic in Pakistan. We have lot of peripheral vascular trauma in Pakistan. Then aneurysmal disease is not uncommon in Pakistan, and smoking and smoking related problem with peripheral vascular disease is quite common in Pakistan. And there are most of the hospitals are lacking vascular surgery specialties and services. So if, the scope is huge. If one wants to get this training and get the skills and knowledge of that, they can easily apply and get job anywhere and even start their own practice.
डॉक्टर ज़िया, कोई आखिरी पैगाम हमारे स्टूडेंट्स के लिए, जूनियर डॉक्टर्स के लिए कि वो इस फील्ड में आए या ना आए? आप तो कहेंगे कि आए, तो वो क्या चीज़ है जो इनको खींचेगी towards this field?
I will strongly encourage everyone to see vascular surgery as this specialty, but I will say this is really a demanding field. One have to see its limitation and limitation of oneself, because one has to keep the work-life balance, because one day you will be scrubbing in a case which will be peripheral vascular trauma. It will take whole of the day. Next day you will be scrubbing in a bypass surgery which will be quite long, and you will be helping the patient. So you have to see that this struggle will continue in your whole life. Then one have to see that there is another aspect, that the technology is coming quite quickly in this specialty, and one has to be expert in different techniques and technology. So different aspects are there. So I strongly say that when you are selecting, you have to see the scope and also see your own limitation before selecting this specialty.
डॉक्टर ज़िया, बहुत बहुत शुक्रिया, आपने तफसील से बताया कि FCPS वैस्कुलर सर्जरी किस तरह किया जा सकता है और ये कितना डिमांडिंग फील्ड है। अगर आपने मेरा YouTube चैनल अभी तक सब्सक्राइब नहीं किया तो करें, क्योंकि FCPS कैरियर गाइडेंस में अभी बहुत सी स्पेशलिटीज़ और सब स्पेशलिटीज़ बाकी हैं। तब तक के लिए अल्लाह हाफ़िज़।